So they gave the last treatment, and I was still actively getting worse, to the point that my hematologist told my parents, who were on shift at the hospital. They and my wife really traded on and off. They told my parents that there's nothing else that they could do, and that they should start getting ready to talk about palliative care and to say goodbye that week.
What happens when the clinician becomes the one in the hospital bed? In this episode, I'm joined by Jared Maynard, physio, coach, and strength athlete, for a story unlike anything we've shared before. Jared walks us through his shocking health crisis, a diagnosis of HLH that landed him in the ICU on life support and unsure if he'd ever return to his family or himself. We talk about what it means to lose your strength, your independence, and your voice, and the deep clinical lessons Jared learned in that vulnerable role as a patient. You'll hear how small acts of humanity shaped his recovery, how he found purpose again, and how his entire experience changed his career. If you ever wondered how to show up for patients when you don't have the answers, this conversation will move and challenge you. Let's get into it.
This is the Modern Pain Podcast with Mark Cardula.
I'd love if you could talk about, because you're somebody who's been in the lived experience, and this is why I really thought it would be a great conversation to have, as far as somebody who really had to take the role of the patient and really had some challenges with their health and had to engage in a healthcare system. And we haven't even talked about it yet. I'm curious to hear what the good and the bad is. But before we get into that, can you kind of let people know some of the challenging situation that you faced and where it put you? And then we'll get into more of the kind of challenges the healthcare system posed as part of it.
100%. The story really starts in almost exactly a year ago in 2023, maybe a little bit more than a year ago. It was after New Year's, and I started to feel sick. Didn't think much of it. It's the time of year that everybody gets sick, much as we're talking now. The thing that started to tip me off that this was different was a week later, I was starting to get worse. And while my wife and my daughters had the same sort of illness or bug, they were all better at that point. So thus began this 2 or 3 week stretch where I started to notice more symptoms beyond the usual fatigue and malaise. I had insomnia for the first time in my life, which was odd. My lymph nodes started to swell, had some sinus pressure. So went to my nurse practitioner because my family doctor was out at the time. We figured sinus infection, got the antibiotics, got a nasal spray, off you go. Running the course of antibiotics, not doing the trick, and I'm getting worse as we go. So the insomnia is worse, my lymph nodes are swelling, and you know those topographical maps that you run your fingers along the mountain ranges? That's what my neck and my shoulders started to feel like. So we knew something was like significantly wrong because this was territory I'd never touched before. So we live out in the sticks, horses and buggies on the road. So we went to a small hospital that was closer to us, and I went into the ER. Got diagnosed with mononucleosis, which brought back instantly memories of high school and being teased, Jared's got mono. I never had mono. My friends were just assholes sometimes. But it was strange because I'd never had mono, nor had my wife. We'd been married for a good chunk of time. No idea how I got it, but apparently I had it. So got prescribed some sleeping medication to handle the insomnia, and then back home I go. It was 3 days after that, around 5 a.m. or so, another night where I hadn't slept. And I'm at the kitchen table, and my wife is looking at me, and she goes, "You're yellow." And we both think, oh, we know something bad is going on. Don't know why my liver's failing, but something's happening. So that was the morning that we called in some reinforcements to watch my daughters. It happened to be the day before my twin daughter's 5th birthday. And we had to drive further to go into a larger hospital that had more facilities because we needed to figure out what was going on. And quick backstory on me. Like I said, I've been involved in strength and conditioning and training for 18 plus years. I grew up as a fat kid with no self-confidence because I got picked on constantly by the kids at school who always reminded me that I was fat and always reminded me that I wasn't wanted on the teams for recess and a gym class because I was picked either last or second last. Parents tried to get me into sports when they saw that I was recoiling from that constant rejection by just hiding in the basement and watching TV. I figured I didn't articulate it this way, but if I was going to be rejected over and over, I was just not going to be around the people who kept rejecting me, and the TV couldn't reject me. So my parents, again, seeing this, they wanted to try to help me out. I tried sport after sport, nothing stuck until Kung Fu. It could have been because I grew up watching Mighty Morphin Power Rangers, but that was the thing that one gave me agency, where if you go from this place of being rejected and feeling vulnerable and weak, and then someone gives you the ability to protect yourself and to carry yourself differently, life-changing. It also started to teach me integrity and discipline and teamwork. And it was the first exposure to an environment where people were supportive and welcoming of me, as opposed to reminding me that I wasn't welcome. That was important for me because then that gave me more confidence to go out and try new things, which after a family movie night and watching the movie Remember the Titans, which is a phenomenal movie, and I should probably watch again after we talk, I wanted to go play high school football. So I went out, played for 3 seasons. And between my junior and senior year, the coaches only had one rule. At the end of the junior school year and before senior summer camp, they did fitness testing. And it was sprints, it was pull-ups, it was dips, it was a bunch of other stuff. And their only rule was if you come back for summer camp and you're better, you get to play. They didn't care about how much. It could be 1 pull-up, which for me, it was 2, because I got 1 pull-up at the beginning and I got 3 at the retesting, which was great. But that's what introduced me to lifting weights in my parents' basement to get better for football. At the end of the senior season, we didn't go as far as we thought we would. We got knocked out in the quarterfinals. And now I needed something to keep me busy for 2 hours a day, 5 days a week, because we didn't have practice. So the gym was there. And it's relevant because that was another taste, a different taste of confidence that really started with Kung Fu. It continued with football, and now it's in the gym. So I continued with that through my undergrad, all through PT school, different iterations of training for aesthetics, and then trying to compete in natural bodybuilding, and then powerlifting, which I still do and I still coach. So that snaps us back to that morning after my wife realizes that I'm yellow and we go to the hospital. Because at this point, I've got many years under my belt where I'm used to being strong, trusting my body, being able to do some pretty cool things. And that morning, when I got out of the van, the entrance to the ER was maybe 20, 30 feet away, give or take. I really didn't know if I was going to be able to make it all the way to the doors, or if my wife would have to go and get a wheelchair, because I was that dizzy. My heart was racing out of my chest. And at the triage station, my heart rate was clocking around 200 and my blood pressure was spiked. And I told the next nurse who did registration, I'm going to pass out here. And I pretty well do. I get admitted to the ER, and then that's where my memory starts to go really spotty, because over the next 6 days, my condition deteriorates quite quickly. And I start to become delirious. I'm on supplemental O2. There's this constant stream of doctors, specialists, nurses in and out of the room, beginning to try to figure out what the hell is going on. My vision is going. I have a pre-existing genetic progressive eye disease, but this was like someone took a dimmer switch for life and turned it down to 50%. My wife told me that later, the scariest moment of her life so far has been seeing me in the ER, her big, strong husband, about 6 feet. I was 194 pounds at the time, so weak that I couldn't get up out of bed to go to the bathroom, and in so much pain. And we had no guarantees about if I was going to be okay, how long we were going to be here. My wife now starts to think about how she's going to break this to our daughters and explain if daddy's coming home and when, and even what the hell is going on here. So 6 days later, I'm still in this tailspin. And that's the night that I get put on life support. As a product of all of the tests and blood draws and images over that 6-day span, we finally landed on a diagnosis of something called HLH, which is an acronym or initialism for hemophagocytic lymphohistiocytosis. It's not a true autoimmune disease, although that's how it was presented to me in the hospital at the time. It's a hyperinflammatory syndrome. It's got 2 types of primary or secondary. Primary is genetic and it shows up usually in newborns. Secondary or adult onset is secondary to either an infection, a cancer, or a different autoimmune disease. In any case, the immune system gets so ramped up and it leads to a cytokine storm, and the system attacks healthy cells, especially red blood cells. And the stats range in mortality rate from 50% to 75%. So at best, I had a 50% shot of making it out of that ICU. And this is where my memory is a black box and I had to be filled in after the fact, supplemented by many pictures and videos, which I still have. But the treatment is brutal, as the disease process itself is brutal too. Placed on life support, I was on a ventilator, I was on dialysis, I had IVs out the wazoo, and the team of doctors and healthcare specialists were fantastic. My hematologist led the charge with a number of other specialists. Between them, the nursing staff, and the pharmacist, they made day by day, hour by hour calls to decide how much of the necessary treatment they could give me, because it's the irony of the sort of thing that you need chemotherapy to as part of the treatment protocol. But being as weak and as ravaged as I was with the disease process, I couldn't handle the full dose. So 5 weeks in total is what I spent on life support. And those first 2 or 3 were the gnarliest, because through the administration of the chemo and the corticosteroids and the monoclonal antibodies and trying to fend off all the hospital-acquired illnesses, of which I got a few, and despite the staff trying to do their best to both treat the illness and avoid pressure ulcers, which didn't stop me from getting pressure ulcers and all of these things, all of my vitals were getting worse. And we were down to the last treatment. It was a monoclonal antibody, because all of the other things that we were doing, according to the treatment protocols, and consulting with specialists at other hospital centers, it just wasn't cutting it. So they gave the last treatment, and I was still actively getting worse, to the point that my hematologist told my parents, who were on shift at the hospital, they and my wife really traded on and off. They told my parents that there's nothing else that they could do, and that they should start getting ready to talk about palliative care and to say goodbye that week. Spoiler alert, I'm obviously still here. And I can only tell you that at that point in time, even after my medical team was starting to make arrangements because they were seeing more decline when there shouldn't be, there was a lot of prayer going on in lots of places. And I started to come out of my nosedive when I shouldn't have. And some of the doctors and nurses who were there with me through the whole ride, once I regained consciousness and I started to get my bearings, they gave me the nickname Miracle Man. Now, coming off of life support and regaining consciousness in the ICU by no means means that I woke up and suddenly was good and everybody clapped. When I woke up, I remember, as I started to understand where I was and started to try to move, it felt like I was waking up in somebody else's body, where I went in 194 pounds or so. And because I couldn't receive much nutrition, though they tried through the NG tube and all of this, the inflammation because of the HLH made it so I couldn't absorb it. So all of that muscle tissue that I built over the years of training in the gym for bodybuilding, then for powerlifting, that started with me gaining the confidence to be in an environment to push myself with kung fu and football and then the gym, ended up being fuel that my body used to buy me time through the ICU. And the journey from that point on really began with a single decision that I at once had to make once and then make on a repeated basis afterwards, because nobody could tell me what the road ahead was going to look like. And like we talked about before we started recording, it was a special kind of head trip to be a physical therapist and to be the person who remembered learning in school and being on rotation, how you come in and do chest physical therapy and you do tracheal suctioning and you teach somebody to ambulate and you use a Hoyer lift to get them into the chair. Now I'm the one who needs that. And it was a blessing and a curse, because in general, as I was part of these conversations and I understood more of where I was and what was going on, it was helpful because I understood who these people were. I understood what was going on and what needed to happen. And at the same time, that made it worse, because I understood how dire this thing was and how far I had fallen. Not only could I not move, I couldn't get up if my life depended on it to go to the bathroom. The actual force production necessary to sit up in bed, I did not have. I also couldn't speak because of the trach. They had to move the vent from initial position to the trach afterwards because of how long it was in. I couldn't swallow either, just because of the atrophy of all the esophageal muscles. I had an intention tremor every time that I tried to write. So if you can imagine, in all of the ways, both as a clinician, as a coach, as a husband, and as a father, I'm used to and I've needed to be a good communicator. I've needed to be the one who's able to get my thoughts across and help people out. And now I can't write down a note to my wife to tell her I don't want her to leave. And I can't say that I love her or ask for something. And I'm completely dependent on everybody else for all of the most humbling, basic tasks that I haven't had to rely on anybody for since I was 3 or 4. So the decision that I had to make was whether or not I was going to fight and work to try to make it back home to my family. And I decided that yes, I was going to, because I wasn't dead yet. And it was simple in that sense for me. If I wasn't dead, then I wasn't done. And there's work that I was going to do. I was going to do everything that I could. And at the same time, being very real. I've known grief and sorrow before, especially as I got my diagnosis about my eye condition, which I got the formal diagnosis around 19 or 20, but we knew something was wrong around 17 or so. When all of my friends were getting their driver's licenses, some were getting cars, and I was being told I can't drive because it's not safe. And this whole vision that I had for myself and my life was now suddenly shattered and changed. So I was acquainted with grief that way, but the grief here was, I'm not sure actually if it was more profound, but it was more not oppressive. There's a different word. The grief before with my eye condition, I could shove into a box. This one was every waking moment, which is why I needed to keep making that decision to keep going every day, which doesn't mean I got up every day. There were some days in the hospital where I didn't have it. And I was angry at the world, at God, why this, why me, and didn't get up for my PT, didn't go for my walks, didn't do my bed exercises. But the next day I did. And that was the process for weeks and weeks of chewing ice chips and swallowing them to retrain my esophageal muscles so I could be safe to eat and drink. Mark, when I tell you that I would have considered pretty serious crimes if I could just drink a cup of ginger ale, that was part of it. It was learning to stand and walk with the other PTs and rehab assistants who, again, I was the guy who was working alongside them not terribly long ago, but now I'm the one who needs their help. But it was taking those walks, and then with the platform walker, and then with the four-wheeled walker, and then the quad cane, finally with a single point cane. And that process continued at home. And it took a year. Really, it took longer than a year to feel like I was back or normal. But just over a year after leaving the hospital, on May 25th of 2024, I returned to my first powerlifting competition after all of this and had a perfect day, went 9 for 9, deadlifted a lifetime PR of 501, and then did it again 3 months later with another lifetime PR of 507. And it shouldn't be a surprise to anybody who listens to this that this whole experience has changed me, certainly physically. And there are scars, both physical and metaphorical, that I still have and that I don't think will ever go away. So I'm changed that way. And part of that change, I believe, has been for the better, if for no other reason than I've chosen to do everything that I can to make it that way in the work that I do, which is especially with coaches and clinicians right now, and with what I'm focused on as I move forward, especially with public speaking. So yeah, when the provider becomes the one provided for, that's been the arc.
An amazing story. I mean, that is a journey and a half. And to go from the healthcare provider to the one provided for. Before we get in, I'm wondering, like, how does your perspective, people have these, I've seen some good friends go through some really challenging health scares similar, and their perspective changed a lot afterwards. I'm wondering, like, how you feel like your perspective on things in life and what's important, maybe what's not important, had shifted as a result of that.
I'll start by saying I think it's scary how easily I can still get wrapped up in small details day to day. And a mentor of mine told me this while I was still in the thick of it. Dr. Frank Benedetto, who's the founder of the Honey Badger Project, he, in one of our earlier conversations, had said for the people that he's known in his life who've gone through life-altering and life-threatening things, it's remarkable how quickly the minutia and the mundane stuff become again. And you think it wouldn't happen, or at least you might. So it's a daily battle that I've got. But when I bring my attention back to it and I realize, oh, I'm worried about the reach that my post did or didn't get on social media, or I'm worried about this other thing, like, dude, you almost died. You're probably going to be fine. That single post probably doesn't count for a whole hell of a lot in the long run. But the positive ways that it's changed priorities for me is, one, it's forced me to put guardrails up, especially when it comes to my work. I'd imagine that many of the people listening here, especially as coaches or clinicians in particular, partially because of the demands of the system, whether you're working in outpatient or in the hospital setting or in other settings, and partially because I think it draws people who are willing to work and are hard workers. They need to get into competitive programs. I have always had the tendency to just work myself into the ground if left to my own devices. And prior to all this happening, I was healthy. And part of the workup was looking into my personal health history and my family health history. And I had no predisposing factors. We checked. We ran the genetic sequencing, and there's nothing that would predispose me to this. So my hematologist told me, like, this is a really unlucky fluke. And as I recovered, I physically and mentally couldn't keep up the same sort of work output that I had previously, which meant that I had to learn to adapt. I had to learn how to adapt in work and in general in my life. And while I would say I'm back up to my work capacity similar to what it was before all this went down. I actively keep up these boundaries in my schedule, and I have better communication with my wife because I very nearly didn't make it back to them. And for anybody who's listening, who's okay, that's intense, heard, it makes a lot of sense. I haven't been through that. Totally fair. And I sincerely hope that nobody else has to go through something like that. Still, you might remember, Mark, when Stoic philosophy really made its foray into the rehab world and still sticks around. I have a tattoo of Memento Mori on my forearm, which I got after this HLH experience, which, for anybody not familiar, is Latin for the phrase, remember you must die, which is true for each one of us. And the reality is we have no idea when that's going to be. We have no idea when that's going to be for our partner or for our kids or for our friends, the people that we really care about. On the ground example for me and my kids, if anybody else has them, is my daughters called my wife up late last night for an extra hug and to be retucked into bed. And on one hand, it's like, it's late, go to sleep. On the other hand, it was the moment of clarity for me of there are only so many more requests for hugs and being tucked in that we're going to get. So that's been the biggest change for me after all of this, is just a greater effort to remind myself on the day-to-day basis of, yeah, there are these things that feel big in the here and now, and maybe they matter for the month. If it's not going to matter in 3 years or 5 years, not to say it has no importance, but you're probably going to be okay. And it's probably not worthy of all of the stress that's attached to it.
Good perspective to gain from that. As far as being a patient and as a clinician, right? And somebody who's usually the one who's giving the advice and directing things. And you had some knowledge, obviously, like you said, as you were telling your story, you knew as you were waking up that you were in a pretty rough situation with what the rehab was entailing and all these different things. I'm wondering, though, if you can reflect as a patient in your journey in the healthcare system, and maybe yours was wonderful. It sounds like you had a great healthcare team. I'm just, as you've had that patient perspective, how's it changed you as a clinician as far as how you see somebody who's going through, and maybe that doesn't have to be something as horrifically challenging as what you went through, but I'm wondering how it's changed your perspective as a clinician, and also working with, like you said, coaches and physios and clinicians who are maybe dealing with some tough stuff. I'm wondering how that's impacted your work.
The humanity has never been on fuller display for me, and I haven't appreciated the importance as much as I do now. What I mean is, through the entire experience, I was amazingly blessed to have, by and large, some incredible people at all levels, both the physicians and nurses, OT, PT, SLP, even the porters, the techs who did imaging. By and large, these people were the moments that stand out the most for me, both in the hospital and then also in all of the follow-up appointments. And this even bleeds over into my experiences with ophthalmologists as it relates to my eye condition. There were days where I felt so isolated and so fearful of whether this was ever going to feel, I was ever going to feel better. Was I ever going to be okay again? Just absolutely swamped by the grief of both the person that I was physically in terms of my life achievements, and now I'm grappling with who am I now, which is really the level of struggle that this was for me, and just overwhelmed by all of these emotions. And there were small moments where a nurse took the time at whatever hour it was in the morning in the ICU to ask, hey, what kind of music do you want to listen to? And I couldn't tell her because, again, I couldn't speak after the trach. So on her gloved hand, I spelled out City and Color and John Mayer. And we didn't get it the first time. It took about 7 or 8 tries. But her willingness to be there and take a few minutes, which again, we're talking about the ICU, where there's always something to do. She took the time to check in on me and to add one small thing that I don't know if she remembers, but I'll never forget that. Or the time that I was in the ICU B. They had 2 levels. ICU A was the most intensive. ICU B was less. I was in ICU B, starting to recover. And my physician, she took about 5 to 10 minutes. I don't actually remember how long it was because I was just sobbing. I was so overwhelmed with all of those emotions. And she just stood by my bedside and held my hand and just let me cry. And she was there. I could keep going with these small memories of even other nurses who were they were cleaning me. They were giving me my wash up for the day. And we were ribbing each other about who the better boy band was between NSYNC and Backstreet Boys. or they'd asked if I had seen The Last of Us, the series, and just that humanity, that dignity, and that intent to make me feel included and not alone and cared for absolutely changed my world. On the flip side, I remember a few moments in particular. One of them was an eye appointment with an ophthalmologist as my vision, degraded after making it home from HLH. And again, the situation where I didn't know what was going on. My condition isn't supposed to get worse until middle age. At the time, I was 33. Yeah, 33. So what's going on? And I'm nervous because this is affecting everything in my life with a primary sense. And that particular ophthalmologist was very detached. He was good at what he did, but he was sterile. And I was on the inside, I was dying for anything. Just tell me that you see me, make me feel a little better. You don't have to tell me everything's going to be okay if everything's not going to be okay, but just give me 2 seconds of you being a human. And it didn't happen. Again, by and large, very grateful for the people that I've interacted with. The majority have been phenomenal. And it's taught me that for me as a coach and as a clinician, whatever the other person that I'm interacting with has gone through or is going through, whether it's an injury, chronic or acute pain, maybe they're the ones who are dealing with feeling overwhelmed and they look at pictures of themselves from years ago and they felt strong, they felt good then, and they don't now. Whatever it is, those are all real situations though. Just having that humanity be at the fore builds the trust that is necessary for any sort of professional relationship. Because if that person trusts me to see them, to hear them, to listen to them, and understand what they want and what they need, and we have that mutual trust to explore the process beyond that, they may not be somebody that I directly can help, but it's a whole hell of a lot more likely that we're both going to understand what they need and what that next step needs to look like. So that's been the biggest thing, I think.
The humanity piece is one of those things that we've had a battle cry on, bringing the humanity back to healthcare. As you've had some amazing experiences where that was put front and center, and obviously had an impact on you as you're reflecting on it. And the frustrating thing, I'm sure you've shared the frustrations of a healthcare system, and like your ophthalmologist. And I think as humans, some of us have more difficulties being vulnerable or just not, and especially some of our authoritative figures in healthcare. There's some physios I work with, but I do think some physicians sometimes have to feel like they have the answers. And when they don't, it's hard to just come down to, I don't have the fix. I don't have the thing that's going to solve this for you, to where we reverse it, where you're looking for just someone to hear and see you as someone who's suffering and really struggling with the journey that you're having with your eye condition. And something I think we can all learn as clinicians, because I think, would you agree, like with a lot of the patients we see in pain, it's not something that maybe we're going to be able to wipe clean to 0 out of 10 from here on out, but having that skill to sit with somebody. I don't know, have you seen that in your care where you can just sit and show that humanity to somebody and how valuable? Because I think there's this misnomer for clinicians that think that, especially young clinicians, where I have to have the answer. I have to have the why, the what, the fix that's going to get this person there. And when I don't, I'm inferior and I can't show that in front of a patient. When you can recognize those situations and just look somebody in the eye and say, this sucks. I don't know 100% of what the best thing is, but here's our options. Here's how we can move forward. What would you value? Where do you see that as far as how your practice and where you see just general practice existing?
So many thoughts. One is, I remember being that clinician for a long time, especially as a new grad who, okay, I'm newly minted. I got my license. I got Miss Susan coming in on Monday. She's in pain. She's coming to me because she expects me to have the answer. I better have the answer. So yes, I've seen that. I felt that. And I think for one, it comes from, I think we can say it comes from a good place, because if you didn't feel that pressure, you wouldn't care. And that's concerning, especially in a healthcare field. So I think multiple things are true and need to be true here for us to do the best that we can. To your earlier point, for both the individual personality level layered on top of our professional role and designation and authority, layered on top of the individual client situation and like the urgency and whatever other emotions are permeating it, all of these can stack and can make it really charged and really hard to navigate. So I'm going to speak validity to all of those things. And I don't believe that everybody listening here needs to take the tack that I personally take. I'm not proposing that. Again, my mentor told me this recently. I'm a very feely person. He said that of me. And it's true. There's probably a reason why the majority of my clients are female. I talked this through with ChatGPT the other day because I wanted to just see, is this coincidence? So there might be a factor. Not saying everybody needs to be that, because everybody's got different experiences, different personality types. I do think a through line, though, is that because our work is with people, there needs to be focus on maintaining human dignity and connection and trying to build as much trust as we can / is reasonable. Actually, I'll walk that back. Just as much as we can. And I don't think that is synonymous with having the answers. I think that you, Mark, I, Jared, anybody else listening, we are fallible human beings, which, yes, of course, we should and we do strive to be as good as we can and to do right by the people that we work with. And we try to be better and learn. That striving is true. At the same time, it's true that we are not going to have all the answers until you or I figure out the secret for omniscience, in which case I'm going to expect that DM when you figure it out. And I'll do the same. I got riled up. What was the question again?
I was getting tailed off there myself as far as thinking ahead of things a little bit. I think just that whole perspective as a student and just being human and being okay to be human and not having that omniscient, I know all presence in the clinic. How does, let's bring that to where you are right now with your work, because I think you see some of the difficulties that clinicians and coaches face, right, with some of their challenges in their career. And we have healthcare systems and a lot of things that bring some unique challenges too. But I'm guessing that humanity still serves you well when you're serving that.
100%. I'm glad you brought that up, because one other point that I think may serve some people to think about, whether it's in the clinical setting or for me, since I'm working full-time in my business online, it comes up here. You said it before, where whether it's chronic pain or a condition, or in some cases, it's a progressive disease. I've got one for my eyes. There are many others that exist. There's something that's not going away quickly or not going away at all. I think of friends of mine who are neuro PTs and working with folks with Parkinson's or ALS or MS. These are difficult things. They're not the only ones that are difficult, but they come to mind. And I've got some skin in the game and experiences here where when you're talking to somebody, when you're with somebody who's dealing with something, they're in it and you don't know how long they're going to be in it. Maybe they're hoping against hope that you're going to have some piece of good news, this shred of a chance that they can have a different path than what they're suspecting they might already be on or need to be on. My belief is that in those moments, even if you can't move heaven and earth to change somebody's situation, or when they finish seeing you that day, or when you log off the computer, they're still going to be in pain. They're still going to have the condition. I still believe that it counts for something to be there and be as fully present as you can be, which means listening. It means asking questions. I do think that means honesty. And sometimes that's honesty that broaches difficult topics. It's saying, hey, you know what? I don't have the answer for that for you right now. And it might also be following that up by saying, here's what I'd like to do if you're open to it. I want to go check in on that question for you. Or I have a colleague here, or I know somebody who might be able to help you. I think that even if you can't erase all of the hardship that somebody is going through, you just showing that you're acting in good faith, doing what you can to help them. My experience has been that people appreciate it and they notice it. And it might seem like small potatoes because you walk away thinking like, damn it, I wish I could do more. I still have those people in my mind. I helped to present at a clinical athlete event in Austin, Texas at the end of 2024. And part of what I was speaking on was, my section was on pain neuroscience education, or just pain science in general. And one of the things that I'd said was, you remember the people that you couldn't help or couldn't help in the way that you wish you could. And I think the longer that any of us are in this position, in whatever capacity that we work, we probably have those people that we think about from time to time. And they may stick with you for a good long time. And my encouragement and belief is that all you can do is all you can do. And that's not a nihilistic, why try? If anything, that's just it's an encouragement to just lean in and give what you've got. And again, be a human. You don't have to be perfect. Just do your best, as I tell my daughters.
Good advice to live by, for sure. For sure. Jared, I want to respect your time, and we'll land the plane with where can folks who want to maybe get to know your work a little bit? You're obviously on social media doing some good things. You're serving clinicians and coaches, and you're doing some great stuff, and also a good speaker just from listening to you in the podcast. And that obviously has come through clearly tonight. So I'd love if you could just share where people can get in touch or get to see your work.
Totally. Yeah, I'm in a few places. Instagram and TikTok. Instagram would be the easiest, but it's the same handle in both places. Jared, JARED.unbreakable. If email is your jam, you can shoot me an email. It's jared@unbreakablestrength.net. And if anything that Mark and I have been talking about tonight resonates, you're going through something, or you know somebody else is going through something, maybe you want to geek out about Lord of the Rings and Star Wars, shoot me a message. I'm an open book. I'd love to hear from you, see where you're at, and if I can help, would love to do that too, especially if you're a coach or clinician.
Yeah, great resource and somebody who definitely is worth having a conversation with. I've enjoyed our conversation tonight immensely, my friend, and thank you for your time and thank you for the great work you're doing.
Thank you, Mark. I appreciate the time. It was an awesome conversation, and likewise, thank you for doing what you're doing for our profession and our space.
I appreciate that, man. For those of you listening, we'd love if you could subscribe to the podcast, and if you know somebody who could benefit from hearing this story and some of the inspirational stuff that Jared has shared today, make sure you share the episode. If you're watching on YouTube, if you could subscribe, we would love that. But we'll leave it there this week. Hope you all have a great week. We will talk to you next week.